Just, because this question comes up quite a bit, I'm just going to attack it up front.
Like they're gonna wake up.
They're not going to wake up during surgery.
Let's
No
just
wake ups during surgery. And unfortunately, media, movies, everybody has glamorized this idea of awareness and I'm going to wake up during surgery. Awareness under anesthesia, that's what we call it in anesthesia and in healthcare. So for people coming for elective surgery, that is not going to happen. There are about 20 different stop checkpoints that would happen or notify us as the anesthesia provider that that your anesthetic was starting to get light before that would ever take place. This is not going to happen. I understand that fear and that unknown, but that is very known to us. So I can tell immediately what's going on while you're actually asleep back there.
So when people say like, or want to know like what it's like, I can tell you waking up too quickly, bad for you. So everybody's worried about waking up during surgery and then being under anesthesia for a longer period of time. Somehow in the whatever information or disinformation world, however we choose to describe this world, it's become concerning, hour over hour that you're under anesthesia, which to a degree, I understand won't operate over 4 to 5 hours outpatient surgery for a lot of reasons. Those patients who have very extended periods of surgery and or blood loss and or changes physiologically need to be monitored typically overnight or in a more, hospital type setting, if you want to think of it like that. So there's a level of care that's different. But for his team, and he can speak to this specifically, like if I'm a patient under anesthesia, I want the appropriate level of care during that, 1.5 to 4.5 hour period, because it actually makes it easier for the anesthesia provider to then wake me up when surgery is complete.
And we kind of, our litmus test across the board is if we would not do the same thing for our mothers, our family, our wives, our friends, then it has no place in our practice. So if there is an optimal anesthetic and I would have, if my wife had to have surgery tomorrow and I would do it a certain way, I want that done for every one of our patients because that is in my mind the optimal anesthetic. They're the exact same anesthetic that I would do for my wife, I would do for anyone that I've taken care of in your family. So it truly is about making that patient experience as absolutely good as possible.